Welcome to the Increasing Language Access in Oregon Learning Module Series. This Learning Module Series presents content from a resource called Increasing Language Access in Oregon, a workbook for providers, which is a plain language, actionable workbook focused on meeting language needs in healthcare settings. There are a total of 7 modules in the series, all of which are intended to be alternative format materials to the different chapters and appendices of the workbook. All recorded modules are available on the OHA Transformation Center website. This module focuses on Chapter 5 of the workbook, Meaningful Language Access Measure. Chapter 5 introduces Oregon's Meaningful Language Access Measure, or MLA measure. This chapter focuses on how the measure helps organizations assess and improve language access for patients who speak a language other than English or who use sign language. Chapter 5 describes the MLA measure and why it is important for advancing equitable care in Oregon. The chapter highlights the 2 components of the MLA measure. The first is a self-assessment survey that helps organizations evaluate their policies, infrastructure, and readiness to provide language services. The second is a quantitative report that tracks how often credentialed interpreters or in-language providers are used. The chapter also describes what types of encounters count toward the measure, such as visits conducted directly in a patient's preferred language, or those supported by credentialed interpreters. The MLA measure tracks how well health systems provide language access to patients with limited English proficiency and to those who use sign language. It helps ensure patients receive safe, high quality, and equitable care in their preferred language, while also holding organizations accountable for collecting and reporting accurate interpreter and in-language service data. But why does data collection matter? It shows how consistently interpreters and in-language providers are scheduled and helps identify where gaps in access remain. The data guide training, resource allocation, and workflow changes that make it easier for patients to receive services. And finally, documenting when you work with interpreters and in-language providers builds transparency and demonstrates compliance with both state and federal requirements. The MLA measure has 2 components. The first is the self-assessment survey, which focuses on organizational policies, workflows, and infrastructure to support language access. The second is the quantitative report, which tracks how often credentialed interpreters and in-language providers deliver care to patients. Component 1 of the MLA measure is the self-assessment survey. This survey helps organizations evaluate how they currently support language access for patients who prefer a language other than English or who use sign language. Coordinated Care Organizations, or CCOs, are responsible for implementing the activities outlined in the self-assessment survey. CCOs also guide providers on the policies and procedures needed to meet Component 1 requirements and to strengthen language access infrastructure overall. Component 2 of the MLA measure is the quantitative report. This report evaluates how well providers and healthcare organizations meet patients' language needs over time. It measures the actual use of language access services during patient visits using data submitted through the Language Access and Interpreter Services report. The data collected helps calculate how frequently qualified or certified interpreters and in-language providers deliver care. These visits are represented in 2 simple metrics: the number of visits with language services provided, this is the numerator, and the number of visits that needed language services, this is the denominator. Together, these data points show how well a health system is meeting its patients' communication needs. The Language Access and Interpreter Services report collects detailed visit-level data that OHA uses to calculate Component 2 scores. The following data elements are reported for each visit: Medicaid member ID, type of care, such as physical, behavioral, or dental, care setting and visit date, modality of language service, whether in person, telephone, or video, language interpreted, and whether a qualified or certified healthcare interpreter was present, OHI/HCI registry number, whether the provider was proficient in language, whether the interpreter was bilingual staff, if the member refused language access and the reason for refusal, the hospital or facility name and national provider identifier, and documentation of good faith effort, when applicable. The final section of this chapter clarifies which visits count toward the MLA measure and which do not. Visits for members with language access needs are included in the measure denominator, minus the following exclusions. A good faith effort to find a credentialed interpreter did not succeed and a non-credentialed interpreter was scheduled. A member declined interpreter services because they did not need language services for the visit. A member declined interpreter services because the visit was with an in-language provider without documented proficiency. An interpreter must be offered in this scenario. Visits that get credit toward the measure numerator include visits with a provider with documented proficiency in the patient's preferred language, visits with a credentialed interpreter, regardless of employment type, whether in-house, contracted, or through a language service company. Visits that do not get credit toward the measure include visits with interpreters who are not credentialed, including uncredentialed bilingual staff. This concludes the module focused on Chapter 5. To summarize Chapter 5, the Meaningful Language Access Measure helps Oregon's healthcare organizations evaluate how well they're meeting the language needs of their patients. By combining the self-assessment survey and quantitative reporting, the MLA measure provides both a snapshot and a roadmap, showing where language access is strong and where more progress is needed. Together, these efforts strengthen Oregon's commitment to equitable communication and culturally responsive care for all patients.